Discussion on chest X-ray showing dilated right ventricular outflow tract. X-ray chest PA view showing a bulge along the left border below the aortic knuckle and pulmonary bay. Sternal wires are seen near the midline, which would suggest that the person has possibly undergone a cardiac surgery by sternotomy. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Bulge below the pulmonary bay can be due to several reasons. 1. Prominent left atrial appendage as in severe mitral stenosis. 2. Dilated right ventricular outflow tract as in Epstein's anomaly or endomyocardial fibrosis. 3. Submitral left ventricular aneurysm. 4. Bulge due to partial absence of left pericardium. 5. Levopost aorta in L transposition of great arteries. 6. Dilated RVOT can occur in case of severe pulmonary regurgitation after repair of tetralogy of Fallot with a transannular patch. The most likely possibility in this person with evidence of previous sternotomy is the last option, that is aneurysm of RVOT after TOF repair. A study of 85 patients after repair of tetralogy of Fallot found right ventricular outflow tract aneurysm or akinesia in 56% of them. This was documented by magnetic resonance imaging. RVOT aneurysm was noted in 16 patients while akinesia was found in 32 patients. This non-contractile region of the right ventricular outflow tract contributes to a decreased right ventricular ejection fraction. The finding was noted in those who did not have a patch in the RVOT also. Non-contractile region in those who did not have a patch repair could be due to infundibular resection and interruption of the coronal branch of right coronary artery. Right ventricular outflow tract aneurysms late after repair of tetralogy of Fallot in adult patients has been associated with sustained ventricular tachycardia. Here are a couple of important journal references on right ventricular outflow tract aneurysms after TOF repair and their arrhythmic potential. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.